Keeping things simple and safe for seniors needing health care. That's one of the goals for the startup Tandem365 10 years ago. And now we're getting a checkup on how this vital resource in West Michigan has grown and continues to care for Michiganders across the state. Teresa Toland is the CEO of Tandem365, and she's joining us along with paramedic Marilee Bradford. Good morning, ladies. Thank you.
Good morning.
Appreciate it.
Thank you for having us.
Absolutely, our pleasure. Tandem365, for those who don't know what you do, could you please give us an overview?
Sure. So an elevator speech, so to speak.
Right, right.
We are more of a care management paramedicine program. There's a lot of community paramedicine programs across the nation. We've blended ours to be more of an advanced illness type model that takes care of people in their homes that are complex medical.
Okay, but yeah, what you just said right there, I think, is key for what you do in their homes, right?
In their homes.
So you basically can take the care that they might receive, say, in an emergency room or those long waits that you see at the doctor's office, and put that in the home to make things simpler, to make and remain safe, right?
Correct.
That's what we're doing. And Marilee, you're one of the people going into these homes and doing this work. Can you talk about what you do?
Sure. So I do go into the patient's home and meet with them on a regular basis. I make sure that they, it's not just me, we go into the home and make sure that they are following their physician's recommendations, that they're taking their medications like they're supposed to. We actually go over their medications to make sure that there's no interactions between the medications that one physician has prescribed as opposed to another physician.
Sure.
We make sure that they're safe and stable in their home, and we identify any needs that they might have, any community resources that they might benefit from.
Yeah. And you do all this in the convenience of their own home. They didn't have to find a ride to get someplace.
Yep. It's all about prevention. If we can go into their home and identify something that, a concern that might escalate into something more significant that might take them to the emergency department or the hospital, we can. That's huge.
Yeah, absolutely. I think many of us may be remembering the days of house calls.
Yeah.
The day when that actually was more common. Let's talk a little bit about your growth, because not only in how many people you're reaching, but the types of services that you're offering as well has grown.
Yeah, well, I mean, we've learned a lot in 10 years, of course, and we're growing across the state. We are in 6 counties here in West Michigan, and now we're over in Wayne County just recently as of April. Our goal is to continue to reach out over there as well, continue to increase our census and our enrollments, of course. And
the things that you're doing in the home, though, people might be thinking, well, this isn't just a regular doctor's checkup.
No.
We're talking IVs, we're talking x-rays in someone's home? Talk about that.
Correct. Well, if they identify a need, then we have contracts with x-ray companies, and we just reach out and they come in the home and x-ray, and with a doctor's order, of course. We work directly with physicians.
Absolutely. This has got to be a godsend. Talk about the type of people like Marilee. Who's your team?
Well, our team are nurses and social workers, our paramedic team, of course. We have medical assistants that manage the medication setups and things for patients. It's a team approach, really. They meet every day and they talk about their list of participants and what their needs are. Staying on top of a big team of people, like 270 people on a team, to take care of every day requires them talking to each other and planning very well what they need.
Absolutely. I bet the logistics are something to behold with
yeah,
that
it is.
many
It's
people.
a daily process, right?
And you're actually in the homes, Marilee. So talk about what type of feedback are you getting from your clients, from these folks? I mean, they've got to feel so relieved to not have to worry about the transportation or the long wait sitting in a doctor's office or a waiting room.
Or the long wait getting to the doctor, if they have to make an appointment.
Sure.
Sure, they love the fact that we can come in there and manage whatever problem that they're having, like within 90 minutes. We have 90 minutes to respond to them.
Wow.
So, we can go in there, and whether it's an urgent need or a non-urgent need, when they call us, we triage the call, and if they need an ambulance right away, obviously we're going to send an ambulance. But if they don't, if it's something that we can get to in 90 minutes time, we will send our paramedics out there. We will assess the problem, work closely with the physicians to make sure that that problem is managed.
But yeah, addressed.
Right there in the home.
And you keep 90 minutes. You said that a couple of times, and I'm thinking I have spent more than that in an emergency room waiting room.
Yeah.
I have sat for well over 90 minutes in one of those rooms. So to actually have that type of response time and not have to go anywhere right in your home, that's just got to be such a great resource. How can people get involved? Like maybe there might be someone watching right now saying, we need this resource. How do we get a hold of you?
Well, the insurance company that we work with, it's complimentary, but if you don't have that insurance, you can always pay privately. and they can get in touch with our office and get more information about that. But we can take care of anyone who's interested and qualifies for sure.
Absolutely. And you mentioned with insurance, there's a possibility for this to happen at no cost.
Correct.
Wow. So obviously that is a huge deal for many people watching right now. Thank you. I cannot wait to see where Tandem365 continues to grow. Here we are getting bigger in Michigan. Who knows where it'll take us. If you're interested and you want more information on this, Tandem365.com. Highly encourage you to check that out today. Thank you for the time this morning.
All right. Thank you.
Appreciate it.